modalities with referral and first contact clinical practice. It is the most important rehabilitative service needed in a community and a vital therapeutic supplement of the medical profession, integral to the treatment of most patients. We as physiotherapists must have a thorough knowledge of the human anatomy and the way the bones, muscles, and nerves move. We treat a wide range of ailments, so specialization is possible in this course in areas such as pediatrics, geriatrics, orthopedics, sports physical therapy, neurology, electrophysiology, cardiopulmonary therapy, hand rehabilitation, manual therapy, women's health, ergonomics, and many more. As for the scope is concerned, physiotherapists have a wide range of scope in India as well as in abroad. We are appointed in government hospitals, corporate hospitals, primary health centers, educational institutions, research centers and community centers, and also in the sports teams. Also, we can have our own private practice. The job of a physiotherapist, which is preventive, restorative, and rehabilitative, is challenging but lucrative at the same time, and above all, you can all call yourself doctors. To accomplish all this, you have come to one among the oldest and best higher education institutions, Institute of Physiotherapy, which is located at a scenic campus in Pandeshwar, Mangalore, and is functioning with the aegis of Sri CAA Raghavendra Rao ji, leading chartered accountant, a successful businessman, educationalist, and a philanthropist. The mandate of this college is to impart quality education to all, irrespective of various social and cultural backgrounds. Along with the mainstream curriculum, the institute also provides additional training in language and communication, personality development, career counseling, and guidance to enable you to achieve a fruitful and best career. This is in tandem with our Srinivas group mantra, Samagra Jnana, which means holistic enlightenment. When you will be studying here, you can make use of the best facilities available with us that make our institute unique and outstanding. An exhaustive physical infrastructure and large well-furnished spacious lecture halls equipped with direct projectors and LCD facilities. Library equipped with over 3,500 excellent, recently updated collection of books, periodicals, journals, and magazines. Competent faculty of high academic caliber who have acquitted themselves and competed very favorably with the rest in the country. E-library facilities, which gives access to thousands of online journals and e-books for assistance in evidence-based physiotherapy and clinical practice. Research lab with ultra-modern equipments like repetitive magnetic stimulation, EECP, virtual reality, electrodiagnosis, motion analysis system, pulmonary function testing, and many more. Numerous number of undergraduate and postgraduate research projects and publications in national and international journals have become the hallmark of our institute. Our very own 750-bedded Srinivas Hospital, located at Mukka, where you can get adequate clinical exposure, which will help in the clinical training phase. Also, we have hostel accommodations. For boys, it is at Hilltop, and for girls, it is at Srinivas Hostel, located in Srinivas Hotel, with mess facility. There's also transport facilities available for the hostelites to commute between the college and the hostel. Now, coming to the main part, that is your course curriculum, I'll be going first with BPT, then DPT, and finally with MPT. BPT is a 4.5-year course, as you all know, with 4 years of study and 6 months of compulsory internship. Now, from 2021 batch onwards, we have implemented the National Education Policy 2020 into our curriculum. This is the first physiotherapy college in entire India which is to do so. In the first year, you will be learning preclinical subjects which will be forming the base for your career, and also along with that we will be including even language and communication related subjects like English, Kannada, Hindi, Sanskrit, Arabic, German, and French. In the second year, you also will be learning about certain other clinical subjects like pathology, microbiology, and you will be introduced into the physiotherapy mainstream subjects of exercise therapy, kinesiology and electrophysical agents, and communicative languages. And also we will be starting basic clinical training in the first year itself. Till now what was happening is the clinical training phase used to start only after the from the third year onwards, but now we are going to start it in the first year itself. You will be learning how to communicate with the patients and how to go up with the clinical examination and management. In the third year and final year, you will be exposed to clinical subjects where you will be learning more about the different specialities like your orthopedics, neurology, medicine, surgery and cardiopulmonary, also along with community medicine. And along with that, you will also be having exclusive clinical training to assess and manage patients at our outpatient departments and also in Srinivas Hospital, Mukka. And related to the exams, it will be conducted at the end of every semester. That is, every 6 months, the exams, university exams will be conducted. The specific guidelines related to it will be explained to you in the coming classes. Apart from the subjects, according to MEP, you also have an option to take something called as open elective subjects. Okay, these are not related to physiotherapy. They are related to other streams in your arts, commerce or science backgrounds. Like for example, it can be photography, it can be event management, okay, anything. So you have an option to choose which one you want to train yourself into. So it's an additional credit for you to know something other than your physiotherapy field. And after completing all the 4 years, there will be a 6 months of compulsory rotatory internship, which will be where you will be posted across various departments and even there will be outpost clinical postings. Now coming to Doctor of Physical Therapy, this is a bit different when compared to your bachelor's. This is a 6-year course which has 5 years of study and 1 year of compulsory internship. And this curriculum is prepared on the CAPTA guidelines to meet the international standards so that when you are planning to go abroad, the processing becomes easy. Coming to the MPT program, it's a 2-year full-time course with specialities like musculoskeletal sciences and sports, neurosciences and practice, cardiopulmonary sciences and practice, community-based rehabilitation, pediatric sciences and practice, and obstetrics and gynecological practice. Here again in the first year you will be introduced to common subjects which will be common across all the electives, and in the second year you will be exclusively taught and trained about your elective subjects along with compulsory dissertation or thesis. Apart from lectures and clinics, the PG students will also be undergoing presentations where they have to give presentations related to seminars, journal presentations, case presentations, and also paper or poster presentation in the research field in conferences is compulsory for the postgraduate students. Coming to the attendance and internal examinations, 75% attendance is mandatory for be eligible for the university exams. If you are not having 75% of attendance, you will be not allowed for answering the university exams unless there is some very genuine reason. And related to leave, please take a note, dear parents. Students are allowed only for 12 days of leave in a semester. That means in 6 months, in a year, 12 days only is permitted for leave for both BPT as well as MPT. That means it is 6 per semester. Beyond that, it's not that we won't be allowing, we may allow, but later on exam time, if there's an attendance shortage, we won't be giving any justification for it. You have to justify yourself. Okay, so please be careful in taking your leaves. Unnecessarily, please don't call your children home for this function, that function. Now for the next 4 years, let them please forget all the unnecessary functions. Okay, they are coming into the medical field. So in medical field, you all already know that doctors don't take leaves. Okay, similarly, we as physiotherapists also should start training ourselves from now itself. Okay. And internal examinations, you will be having 2 internal examinations per semester, and apart from internal examinations, there will also be continuous internal assessment will be done, okay, based on your presentations or assignments given or any record work, or if any practical demonstration is asked based on your performance. Okay, so it's a ongoing learning assessment in the 6 months based on whether to know whether how the learning process is happening, and accordingly the marks will also be given weightage to that part also. So your internal marks for your university exam will be a combination of both your internal papers plus what ongoing assessment is happening. Coming to the general rules and regulations of the college, okay? The classes will be held between 8:30 to 12:30 p.m. in the morning session and between 2 and 4:30 p.m. in the afternoon session. And please note, Saturdays is not a half day. Saturdays is full day. If any student is telling the parents Saturday is half day, please don't listen to them. Saturday is not a half day. We work full day. And students during the class hours should not loiter in college premises while classes are in progress, or when there are no classes, they are expected to either be in the library, and the postgraduate students, they are expected to be in the departments, okay, instead of loitering around in the corridors. If they are caught or found to be so, they will be punished. And for BPT and DPT students, the undergraduate students, you all have a prescribed uniform. Okay, details regarding to it will be given once you come and join the college. So there will be a uniform above which you will be wearing your apron, and ID card is compulsory. For MPTs, there is no uniform, but formal dressing and grooming should be maintained always. Usage of mobile phones is prohibited in the campus during college hours. So please, parents, don't keep calling your students every now and then. If they are found with phones, the phones will be confiscated and will not be returned for at least 1 week, or they may be fined. So please see to it that you are talking to them outside colleges, that is in the lunch break time or in the evenings, unless it is an emergency. If it's an emergency situation, please students come and take prior permission from your class coordinator to use the phone, then only it will be permitted. And irregularity in attendance, discourtesy to staff members, habitual late coming, neglect of work, obscenity in words or action are punishable by either permanent or temporary dismissal. Minor offences are punishable by a fine or loss of attendance. Now coming to ragging issues. Okay, our college is a ragging-free campus. We also have an anti-ragging committee which is formed, so the students can anytime approach them. Their contact, the details of them will be put up on the notice board in the coming days. So you can take a note of it and contact them anytime you feel that you are ragged, or even your friends, anybody is getting troubled by the seniors. You can anytime inform. Don't be scared thinking that the seniors will again do something to you. Nothing is going to happen. It will be cut down immediately. Okay, so you can anytime approach the faculty and inform. And also we have a mentorship program, okay, for the UG students, that is during their first 3 years there is a mentorship program. That means one faculty will be allotted 15 students, 15 to 20 students from the batch. So they are their mentors. So anything related to academic issues or personal issues, they can meet that mentor and discussion will be happening. Any problems will be solved, or any advice, any suggestions required can be taken from the mentor. Okay, so this will be during the first 3 years of your study. And also coming to the extracurricular activities, we have certain clubs and forums which we have in our college, for which the students are welcome to join. Okay, some of the clubs I'll name: this Fine Arts Club, Culturals, sports related clubs we have. There's an NSS group, there's Debate Club, Photography Club and Quiz Club. Apart from this, there are many other clubs and forums to which students can join, and accordingly the activities will be planned. Apart from that, we also have certain other extracurricular activities like your Freshers Day or farewell, and also we have festival celebrations like Holi, Onam, Navratri or Christmas. And also there is an annual sports and cultural meet every year which is conducted in the institute. Last, coming to the vacation part. I know all will be waiting for vacation. When will we get holidays? Okay, coming to the vacation part. For BPT students, it is once in a year, that is in the month of May. In the month of May, the entire month will be given as vacation to the BPT students, BPT and DPT students. For MPT students, Only in the first year. You will be getting 15 days of vacation only in the first year, that too in the month of May itself. But when you come to second year, you will not be getting any vacation. So please don't come asking, please give us vacation, okay? So it's not there as per the rules, okay? So briefly, these were the rules and the layout about our program. Further in detail, you all will be oriented in the coming days when you are coming for your classes. I hope I have given some overview. We have got an idea what is to be expected. So meet you all in college, and all the best to all.
Thank you, ma'am. The program has come to an end. So as ma'am said, from tomorrow onwards, regular classes will begin. So classes will start from 8:30 a.m. in the morning and they'll go up till 12:30. 12:30 to 2, you'll have lunch break, and 2 to 4:30. Okay, and also you will be given the uniform, okay, along with the lab coat. Okay, so both of this will be given from the college. We have a tailor associated with our college, so he will come, take your measurements, and he will give you all. So you need not go out and buy the lab coats. Will be provided from the college. Okay, so until then you'll have to wear formals. Okay, so I just want to make it clear. So when it comes to formals, obviously, okay, when it comes to boys, okay, it has to be a shirt, okay, and formal pants and formal shoes, okay, and for girls it is you have to wear a kurta, okay, or a salwar, okay, which has to be knee length or below, okay, and yeah, and no informal or casuals are allowed. Okay, no casual shoes are allowed, no jeans are allowed, okay, and no heels or excessive jewelries are allowed, okay, and no excessive makeup is also allowed. Okay, so just keep that in mind. Okay, so because it's a professional course, okay, because in future you'll be working in a hospital, okay, with your patients, so we are going to make you ready from now onwards. So please keep in mind, you have to come to the college dressed formally. Okay, so any kind of informal dressing or informal attire will not be welcomed. Okay, obviously you're a first years, okay, in the beginning we'll be giving you warning, okay, first 1 or 2 times. If still not followed, then you'll be fined. Okay, and still not followed, then your parents will be called. Okay, so please keep that in mind. Yeah, so today we'll be finishing our program, so you all can go back, okay, and if you have any still admissions, procedures are still pending, you all can continue that, okay. If not, I'll see you all tomorrow morning 8:30. Thank you. If you have any questions, you can ask. If not, you all can